Hi, my name is Debbie, and I am obsessed with all things to do with ultrasound. I'm an empty nester who has spent the last 28 years scanning in all different kinds of situations: clinics, hospitals, point of service, emergency departments, private offices, echo, vascular, general, high risk OB, and want to dive down deep into all things to do with technology, techniques, and transformation. It's time we take ultrasound to the next level. Think of this like your little power boost on your commute to all things ultrasound, along your way to the thing that we call work. So pull up a seat, make sure you're comfy, and be ready to be challenged and encouraged as we learn it's all about the frequency. Today, our guest is Margie Dotson. Margie has been an ultrasound technologist since May of 2014, worked in the hospital setting, but originally got an injury early in her student career from ultrasound, and then later had another injury later working in a hospital. She had to do a major shift and decided to build some businesses, one being a business in photography. She has honed her craft to specialize in three distinct yet profoundly empowering fields: boudoir, branding, and portrait photography. Her journey has been defined by a commitment to celebrating the strength and the beauty of women while aiding female entrepreneurs in achieving their dreams. Please help me welcome Margie Dotson. Thank you, Margie, for joining us on this podcast today to talk about the ever topic of ergonomics.
Of course. Thank you for having me.
You're welcome. Ergonomics, everybody wants to talk about when we've scanned maybe 10 plus years. Everybody wants to talk about it all of a sudden. And I know it's talked about in schools. I've talked to instructors who talk about it. But when you're first starting out and you're so overwhelmed and trying to learn everything, I think that's one thing as like a clinical instructor, we kind of forget about really honing in on that. And I think it's always going to be something that we need to address, right?
For sure. Yeah, I agree with that.
I don't think we think about that, right? Like a CT tech, maybe when you're transporting patients or moving patients from wheelchair to table, things such as that, but not for a prolonged period of time, not with consistent pressure, not with the limitations that we have, right? Of patient size and different things. So Margie is here to discuss that and go over her experience and talk with us about that and what she's done to fix some of those issues and what we can do to not get hurt. So tell us a little bit about yourself, Margie.
So just a quick intro. I am currently a PRN sonographer and full-time photographer. I've been in the field for about 11 years. I worked in the hospital experience since I graduated. So I went from school straight into one of the busiest ERs in Central Florida. I did PRN there as well, but it was basically like a full-time job. They used me as a full-time tech. Um, I had to transition down to actual PRN status because of an injury. So here we are.
Yeah. Yeah. So you also do photography.
I do.
Right. And and you've had to make that choice because of your injury, right? Not because you chose to, right? You were forced to make quick turn on a dime kind of a decision in order to make a living, correct?
Yeah, so I had my photography business pretty much about the same time that I was starting ultrasound. And in about 2020, 2016 is I actually had two things happen. I had my herniated disc and I had my first panic attack. So
Oh, wow.
there's that. And that's when I really started thinking about my body and advocating for myself. When we started to have to transport our patients, my back hurt so much. And I voiced that opinion during all of our meetings, our staff meetings, where we talked about, turnaround times and this and that. I said, hey, my back has really been hurting since we've had to start transporting our own patients. Can we maybe work on that? But of course, nothing changed. So after that happened, I said, I really need to advocate for myself. And I brought myself down to PRN. Unfortunately, the injury was so severe that I really needed to give my body a couple months of not doing ultrasound to
Hmm.
heal properly. So in 2023, I decided I can't do this. I'm in pain every day. I just can't. And so from 2016 to 2023, I gave it a fair shot and I said, I can't, I really can't. So I took a year off.
Nice. But you had an earlier injury as well, right? When you were a student, possibly?
That's right. I forgot about that. Thank you for reminding me. It's so crazy. We utilize ultrasound so much now. It is the first course of action that really insurance wants to take
Right.
for treatment, right? So we are utilizing ultrasound so much more than we used to. And I suffered a torn rotator cuff in my last couple months of my program. So I hadn't even graduated yet, and I had already suffered an injury.
So, how did you know you tore your rotator cuff? What were some of your symptoms? Oops, I think you got frozen there. Let's see if you come back to us. I don't know. Hello. Oh, there you are.
Hey, where did you lose me?
So let's try that question again. So what were some of the symptoms that you incurred when you tore your rotator cuff? Like, how did you know? Did you know immediately? Was it a progressive thing? Like,
That one was, because I've done it twice, that one was more progressive. I didn't realize it was going on until one morning. I really had a hard time lifting my shoulder. And I said, okay, there's something wrong here. I need to go see a doctor. And he told me, you have a partial tear. So that's why I was still able to scan and do those things because it was just a partial tear. He told me that I needed to go to physical therapy and had to, maybe rest it. But as we all know, we're in clinicals and we can't do that. We graduate. We have to keep going. So I did. That probably made my shoulder weaker because I didn't rest it and heal it. And a year later, I ended up doing a 90% tear on my shoulder. So
wow. So between the shoulder and the back, those are two pretty big limiting mobility joints, right?
yes.
Or movements in our bodies. So, um, what were some of the things? So you did go to physical therapy, I'm assuming, right?
I did not go to physical therapy for my shoulder. I ended up going to physical therapy for my back injury. And during that time, I told them, I said, hey, I know it's beneficial to treat the body as a whole. I have had a tear in my shoulder. Can we work on that as well? And they did.
Awesome. So what were some of the things or that you learned in physical therapy or some takeaways that you learned that maybe you could share to help with those of us still in the field scanning and wanting to protect ourselves?
So, what I learned, the biggest key was to keep both feet on the ground, right? No matter if you're sitting or standing, because I know we all tend to do that little lean
Right.
on the patient bed. And like, so when I would do that lean, I would also put my foot up on the machine
Right.
just to kind of hold the machine in place and scan and do all those
Right.
things. But what we're doing is really throwing our back out of whack. And when I would go get massages, they'd always tell me your muscle on the opposite side is really struggling.
Right. Right.
So that is the biggest thing is to really keep your spine in alignment and keep both feet on the ground, which was so hard for me to do.
Right.
But it really is keep your hips in alignment, both feet on the ground. And then, of course, what they teach you in school, which is bring the patient closer to you, have the patient move. You don't move, you stay in one spot. I remember when we were a teaching hospital, so when our students would come through, I would, of course, get permission to move them. Um, but I would see them start to do this, and I'd be like, nope, bring your shoulders right back. If
Yeah.
you need to do this, that means you need to move the patient. Is that always possible in a hospital setting? Absolutely not.
Right.
So the other thing that I learned how to do was scan with my left hand. So
Yes.
yeah,
Yes. Yes.
teach you that in school, but my husband actually said, why can't you scan with your left hand? I'm like, well, we weren't taught that. He said, well, learn.
Yeah. Yeah.
Whenever, especially if you're in a hospital setting and you have to take the machine to ICU, you don't know where your machine is going to be able to go. So I would start on the left side of the patient and work on that side. Then I would bring my machine over to the other side of the patient to scan the spleen and the left kidney and all of that. But I would do that with my left hand. It's not easy, but you can do it. And the more you practice, the better you will get at it. And it saves your back. It really does. And your shoulder, because now you're using the shoulder.
Right. Right. So I learned this because I did about 20 years of high risk OB, right? And then I thought I was burnt out. So I went back to school. I got vascular and adult echo, and adult echo scans left-handed, right?
Mm.
So I had to learn after 20 years. So an old dog can learn new tricks, right? To scan left-handed. And I thought, wow. There's different strains because there's smaller movements with the wrist and the hand, I think, for cardiac. But I certainly gave my right arm and shoulder a huge break, right? In 5 years that I did that kind of work. And so then when I went back to high risk OB, because it's my passion, my love, um, my right shoulder got hurt again. It was uh wearing and tearing, and I get headaches. And so,
Mm.
we are so used to, especially as women, right? We push through, we stick with
Yeah.
it, right? We overlook the pain. And all of a sudden I'm getting a headache. I'm like, why am I getting a headache? Because my shoulder hurts, right? And I wasn't, when I would touch it, I'm like, ooh, that hurts, and I'm like, I should have noticed that a long time ago. So being in good connection with your body, touching your body and massaging your body and saying nice things about your body, right? To
1,000%.
be in connection with it. Like, where is it sore? You know, where are the tender points? Like, what can I massage or do to help that? And so I thought, well, man, I've scanned a heart left-handed. I bet you I can do OB left-handed. And I started with simple, like biophysicals, growths, things that I could do right-handed, like 15 minutes, right? Or 30 minutes for a bio, but not super intense, like not a detailed where I'm looking for millimeter structures, right? And it really gave my arm a break. And I thought, that's the answer. We've got to learn to scan both right and left-handed.
Yeah.
I know this is not a popular idea.
No, it's really not, but it should be.
You know what? I've talked to cardiac people who say, I've learned to scan right-handed because when I go to the ICU, I don't know. Am I going to be on the right side or the left side of the bed? Right. So they have adjusted by learning to scan with the other hand.
I
And
love that.
so people do it, right? The people do scan both right and left-handed.
And
And
I
we,
really think it should be taught in school
I do too.
to be, both sides because it's not only your shoulder and your wrist on this side, right? It's your whole body.
Right,
So the muscles along your spine are supporting your body as you do this. Even if it's a slight movement, you're still
right.
using muscular on this side of the body to hold it. So you're going to be super strong here, really weak here. So if we flip that from time to time, you're
Right.
treating your whole body.
Yeah. And even recently, I've had trouble with, in fact, I just came back from a chiropractic appointment. I've had problems with my low back because I was sitting.
Yes.
And I hadn't sat to scan in forever. And I don't know why I all of a sudden started doing that, right? So I agree. Both feet on the floor. I kind of turned toward my patient. I have consciously started like sucking my gut in, like using my core to
Yeah.
stabilize and then scanning. So now I've just kind of slowed my routine down enough to really, okay, the patient is in position. Now let me physically think about getting in position, right? I remember teaching a student and they would go in and start and whatever. I give them like 10 or 15 minutes and then I'd come in behind them. And as soon as I come in, I'd fix their posture, right?
Yes, I did the
Because
same thing.
you don't realize it. You don't
Nope.
realize it. Um, my
You don't.
manager right now, I walked in on her to ask a question about something, and she's all cattywampus. And so I'm like, I wish I could take a picture of you from behind so you can see how uneven you are in
Yes.
scoring so that we can fix it, not to cast judgment at
No,
all,
we
but
all
just
do it.
for protection, right? We don't know that we're doing it. And as soon as I fixed her position, she goes, oh, yeah, that feels better, right?
And the thing is, we don't really notice that it's a problem until it becomes a big problem, until you feel that pain. That's when you notice it and by then it's not too late, but it's still going to take a lot of adjustment to get back to where it's not in pain anymore.
Right, right. And we don't always want to
Yes.
use our time, our PTO or whatever to
Yeah.
take care of that, right? And so I think that's one reason why we kind of push through. We don't want to spend our time that we do have to take care of ourselves when we'd really rather use it to go on vacation, right?
Something
So
fun.
it's important to learn how to take care of yourself so you're not needing to use that time, right?
Hmm.
So I don't know. I think it's just another little millimeter shift that I've used later in scanning to say, okay, I've got to fix this, right? I need to stand straight. I need to suck in. I need to use my core. I need to not twist or lean, right? I was a big leaner, right? And it affects the way I sleep. It affects the way I showed up for relationships or other people because I wasn't feeling good. I wasn't
Yeah.
my best. So,
We
yeah,
almost need an ergonomic buddy. So
yes,
if you're working in a setting where you have team members, just leave your door open while you're scanning if it's not something private and, check in on your teammates and be like, "Hey, sit up straight."
yeah,
Thing like that.
right. Yeah, I love that idea is to have a buddy. Or maybe, some places I've been, they have checkoff sheets, right? Like clean your room and, make sure the machine's clean and, stock your room, do these kinds of things. And maybe we should add on there, check a buddy off on ergonomics,
I
some
love that idea.
something
Yeah.
of that nature. And making it a priority instead of we're already going into this knowing we're going to be injured, right?
Yes.
If you're in this for any amount of time, you're going to be injured. So let's like shore up our shores, right? And help each other out. I think
Yeah,
that's
because
great.
it's not a matter of if you're gonna have repetitive motion injury. It's a matter of when. For me, it happened super early. I know that's not the norm, but it's going to happen sometime in your career.
Absolutely. Absolutely. So, what are some boundaries or things that you would recommend?
So some boundaries, it's really just knowing your body. Pay attention to what is out of whack, what doesn't feel good. Really, like you said, touch those spots. I know whenever my shoulder hurts now, it's right on the outside of my shoulder. I could touch where it is. Um, and I always tell people just know where your pain is because depending on where the pain is treatment. Also, KT tape became my best friend.
Okay.
Learning how to reduce inflammation without taking any medication was huge for me, and that's what KT tape does. Um,
Okay.
but really understanding your time boundary, right? Especially I think for outpatient facilities, those that work in outpatient, it's going to be a hard battle, but you can do it. Really tell them, the guidelines of how long you need for a patient, because if not, they will pack those patients in and give you. I had a friend that only had 15 minutes per exam. And do you know how that's so hard on your body? So I think the AIUM guideline black last time I checked was 1 hour per patient. And you need to advocate for yourself to take that 1 hour per patient.
Yeah.
Don't kill yourself. Don't do it as fast as you can because we know we can get it done, but you need a break. And that's what they don't understand is that you need that break between patients.
Yeah, and I think the longer that you do it, the more you kind of slow down, right? Like you realize doing it quickly is not always the key, right? Um, no one needs to be a superhero, right? There's no contest here, right? So, we want to be thorough. We want to not miss things. And I think, yeah, if it's a simple, straightforward exam, yeah, you can get it done in 15 minutes. But what if it's not? You
Yeah.
know, what if you needed more than 15 minutes to get that exam done, to process that, to get the extra images, to
Mm.
have the time to communicate to who you need to communicate in regard to the results, right? I find that when you're in a hurry, a lot of things go wrong.
Oh, 100%. That's when you get the most frustrated. So not only are you causing yourself some pain by trying to scan quickly, but you're also not taking your mental health into consideration either. And
Right.
then that's when you're going to miss something on a patient too. So it's not
Right.
good for anybody.
Yeah. And I think sometimes the younger generation comes in and they're all excited and, oh, we can do this really quick and blah, blah, blah. And the older generation is like, slow down, you know, right?
For
Like,
sure.
we need to like make sure we dot our I's, cross our T's, right? Like, give yourself a break. Like, we need to be able to respect the fact that, yeah, I know you can do it quick. I can do it quick too, right? But let's just keep an even keel, right? Like, just because you get it done early doesn't mean you get to go home early, right?
Right.
We're there for a period of time. Fill that time with good patient care, good communication with the patient, good connection with the patient, right? And slowing down enough to check in with yourself, right?
Yes. Always.
Even with patients that are obese, right? I will work and work and work to try to get whatever images I need. But after a period of time, I'm like, okay, I need a break. I need to step away. I need to step away, right? It's like,
Ah,
it's not a
yes.
matter of I can't get it. It's I feel the pain. Like, step away, take a break, go back at it. And I'll tell my doctors, I have a large BMI. I've been able to get all these things. I needed a break. So when you go in to talk to her, I'm happy. I need to scan some more, right?
Hmm.
So,
Yeah,
uh,
you brought up a really good point with those patients who are limited exam type patients. It could be for BMI or other reasons, but this takes some practice too. It takes some practice to know when you can work and work and work to get that image, or you're just going to work and work and work to just to hurt yourself, and it's not going to happen either way. It does take practice, but really give yourself that grace that you don't have to kill yourself or your shoulder to get those perfect images on those limited patients.
right. And I think good, you know, um, working out, yoga, all those things we need to be doing anyway, right?
I know. Yes,
Someone told me instead of seeing it as a chore or something we have to do, see it as a tool, right? When I work out, I feel better. I'm taking better care of myself. Um,
you have to think about that too as a long-term investment in your career. If
right,
you want to retire in this field, you have to take care of that body and that shoulder.
right. I would hate to do an MRI on my arm right now.
Oh, no.
Right? Um, so you just have to know yourself, right? You are the only one who can advocate and take care of you. No one else can do that for you. So,
Absolutely.
um,
And people are going to face pressures from management, right? They want, of course, the more patients that they see, the more money that they get. So you are really the only one that can advocate for yourself. Make
right,
sure that your voice is heard. And if your voice isn't being heard by one person, go to somebody else. Make sure that somebody hears you and understands the importance
right.
of ergonomics and proper scanning and all of that. Because it really is, unfortunately, it's a battle.
It is. And if we went to HR for work related problems, that would be,
Hmm.
no hospital wants to pay out workman's comp, right?
No.
No one wants to do that. So if, I mean, you're the one who controls your pace of work, right?
Mhm.
So if it's too much, then slow down, right? Or take a break, or like you said, advocate for yourself, but also advocate for your, don't give your power away, right? Don't say, I'm hurt because my manager wouldn't do this, that, or the other, right? You
Just
have
do it.
to um own your power to say, I've been exercising, I've been stretching, I've been trying to build muscle, I've been, stretching my shoulders out, I've been doing these exercises to strengthen myself. I'm standing correctly, I'm using a standing pad, I'm doing whatever you need to do in order to take care of yourself, right? So,
Absolutely.
not giving your power away
Yeah.
to, oh, they're doing this to me. No, we're doing it to ourselves. We can talk till we're blue in the face about this topic, right? We talk about
Absolutely.
years, right? But until we actively demonstrate it ourselves and are taking care of ourselves and then mentor others into doing the same, um, I don't think we're gonna get anywhere. So I think we can't give our power away. I think we have to do all the things that we know to do, right? I think we have to do all the exercises that they tell us, all the stretching that they tell us. I think we're women. We can figure it out, right? We can figure out a way to do that. We can
Mhm.
figure out a way to work out with our children. We can figure out a way to stretch. We can figure out a way to make that a priority in our life.
Oh, absolutely. We can always find the time to do the things that are important to us, and that should be important.
Yeah, especially in this occupation, right?
Yes. If
Yeah,
you want a long career, It is, I would say it's mandatory.
Yeah. Yeah. So, um, advocating as far as even getting doctor's help, you have to advocate for yourself, even with physicians, right? Who,
Hmm.
when you're in pain or that maybe this isn't working or that's not working, or I did, I tried cupping with my shoulder. That seemed to help for some time. I've tried dry needling, which was helpful. So using different methods of help other than just going straight to surgery, right?
Yes, and I have gone through three different orthopedic doctors. The first one wanted to do surgery right away, and this is on my spine, not my shoulder. And I said, absolutely not. That is not going to be my first course of action. Let's not do that. Um, Same thing with the other two. I finally found the third one that said, look, the best I can do is a cortisone shot. I'm a surgeon. That's what I do. So he was at least honest with me and told me that you don't have to do this, but it's what I recommend. That was the first one that really actually spoke to me. Um, and I just, the orthopedic doctors are really there to tell you, to give you recommendations. If it's not something that you want to do or choose to do for yourself, then physical therapy, doing the other things that take away the inflammation. So, like you said, the acupuncture needles, the cupping, the KT tape, things like that that take that inflammation away. Massage is another good one. When I was working full time, pretty much, I had a massage membership and I went all the time. So
Yes,
that is
yeah,
there too.
it's helpful. And then we have to unfortunately mention diet, right? Diet is a huge part of inflammation.
Yes.
So, if for no other reason, to reduce your inflammation in your body to avoid injury, do it for that as opposed to thinking of it as a diet or something of
Yeah.
the nature, right? We're just trying to optimize our health overall and general. And um just sharing personally, I've been through a lot of health issues in the last 5 years, and it's so freaking frustrating, right?
Oh
Like,
yeah.
I'm the one who has to, like, maybe I should try cupping. Maybe I should try this, right? Like, I'm the one coming up with these ideas to heal my body. No one's going to tell you what you need to do. You're the one who has to decide, I think I'm going to try this, or I'm going to try that, or
It
something of
should be.
that nature. And
Yeah, it should be the doctor, but they don't recommend that kind of stuff.
well, but they're trained, right? Like they're trained to
Exactly.
be a surgeon. Can I fix this? Yes, right? I learned that so if you want to have surgery, go to a surgeon
Yeah.
because he'll say, "Yeah, I can do surgery on that and fix that. That's my job. That's what I got training for," right? But they didn't get training in acupuncture. They didn't get training in, dry needling. They didn't get training in some of these other issues.
I always say they are doing the best, they are doing the best that they can with the information that they've been given.
Right. And so you're the one who's in charge. So
Hmm.
you're the one who has to take the bull by the horns and say, how can I reduce inflammation? What can I eat? What can I drink differently? Become more aware of what we're putting in our bodies, become more aware of how we're moving, how we're holding our bodies. So I think really ultimately we have to take that responsibility. Bringing awareness to the topic is always great. And I think, back in the, I've done this 28 years. We used to scan people on stretchers, right? We didn't have exam tables. We didn't know what those were, right?
Yeah.
We didn't have ergonomic chairs, right? And so we were sitting on office chairs to scan, right? So we've come a long way, right?
We
People
have
have
for
listened
sure.
to us. There's floor mats now that we can stand on. Our shoes are better, right? Making sure that we have good supporting shoes. I see these, girls wearing all these cute little Nike shoes and whatever, cute shoes that are not work shoes.
Yeah.
And I think your body can tolerate it when you're young, but when you get older, not so much, right? And I'm jealous because they get to wear shoes that are super cute and their body doesn't feel it, but my body feels it now. So,
Body will feel it eventually.
yeah. So, yeah, I think we can't give our power away, right? I think using the learning from others' expertise, physical therapists, my sister's an occupational therapist, and I went to her and I was telling her about my back condition. She showed me two or three exercises. And I'm like, oh my gosh, what a difference that made for me. I do them 2 or 3 times a day sometimes, and I sleep so much better, you
Oh,
know?
for sure. And we can find all of this information at our fingertips now. You can go on YouTube and
Right.
look at stretches and exercises and all of these things. So the information is out there and it's pretty easy now, like you said.
Right. Yeah. So I guess our final takeaways are what would you say would be the final takeaways?
I would say trust your body. Any amount of pain is not normal. When you feel any kind of pain, listen to your body. Don't push through. So when you're in the ICU and you're leaning over that patient because you haven't learned how to scan left-handed yet.
Not
Um,
yet, but we'll get
yeah,
there. We'll get
but
there.
just take note when you're fatigued, your body will get fatigued from being in that position. Maybe take a break there when you feel that fatigue versus waiting for it to get to pain. Little things like that. Advocate for yourself and your ergonomic needs. I love those ergonomic chairs, but not every facility has them. When I was at mine, I said I would love one of those chairs because it really did help, and I felt the difference in my body when I had one. And then also, like we started this conversation, share with your colleagues and your coworkers, let them know if they're not sitting or standing correctly, and just help each other.
Yeah, and I think the other thing to remember, a few things that came to mind as you were speaking were I have a coworker now who did have shoulder surgery and she's back. And I said, "So how's it feel now? Is it better?" She goes, "It's better, but it's different." So they fixed that one problem, but now there's stress on other areas.
Yeah.
So to think that surgery or one thing is a fix it all
Not
um, might not be a great way to go in to look at that, right?
for
Um,
sure.
and she's young, and I'm worried for her because I think, oh gosh, she has a lot of years she can be scanning, but I don't know what she'll do with her injury, right? I think that will really alter her um progress.
Yeah, and like I mentioned, it's something that you want a long career out of, but because of the overutilization of ultrasound nowadays, I feel like those careers are getting cut shorter and shorter.
Yeah. And I think we need to support each other. Like you said, mentioned earlier, have a ergonomics buddy or somebody to say, hey, just check in, peek your head in and tell me what you think when you look at me from behind. Am I square? Am I really using my body and not just my arm? Right.
Especially the new techs that come in, we really need to do that for them too. Is right when they start their job at whatever facility it is, really pay attention and hone in on how their ergonomics are to teach them properly before they get into, making those mistakes.
Yeah. And I think sometimes I remember saying, coming in and adjusting someone that I was kind of mentoring at times, she goes, "Oh, yeah, I did." Being able to feel the difference of, oh, this to being
Yes.
straight, at least she could feel it in her body, right? And
1000%.
hopefully that will cause her to be more conscious of it, right? When you actually are feeling it in your body and it gets corrected, I'm hoping that makes enough of a difference that we'll remember, right?
Oh yes, I 100% agree with that. If you catch it early and you feel the difference, that's really key.
Yeah, I appreciate you sharing all these points. I'm sorry that you are not a part of our community full time.
Okay.
I'm glad that you found other alternative forms of work,
I
but
say that I take pictures of people's insides and outsides.
and outside. That's right. I love it. But thank you for bringing this to our awareness because it is something that we should probably talk about often so
Yeah,
that people really become more aware of their body and protecting it and advocating for it. So thank you for your share. Thank you for sharing your experience and your story. And I hope this helps everyone. And this gives something, maybe one little takeaway, one little thing, both feet on the floor or sucking in your core so that you're working from your strength, your core strength. One little takeaway. We're just looking for millimeter shifts, right? Just one little thing to take your practice to the next level.
absolutely. Just a little slight shift makes a ton of difference.
Perfect. Thank you so much.
Of course.
Thank you for tuning in to It's All About the Frequency podcast. I hope you enjoyed today's episode. Share it with a friend and remember to keep your frequency high.